Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Agricultural poisoning. First, organophosphorus compounds. Mechanism of action. Organophosphorus compounds are very potent cholinesterase inhibitors. They inhibit both types of true and pseudocholinesterases. Signs and symptoms. Muscarinic symptoms. Like the patient suffers from muscarinic symptoms like salivation, lacrimation, urination. The patient has diarrhea with gastrointestinal diuresis. The patient emesis or vomiting and meiosis is seen. And the patient also has nicotinic manifestations like muscle weakness, areflexia, tachycardia, cramps, and hypertension are seen. The patient has CNS manifestations like generalized weakness, ataxia, slurring of speech, tremors, confusion, headache, drowsiness, depression, respiratory center depression, coma, and finally the patient can lead to death. There is a term in organophosphorus poisoning which is chromdoria. In chromdoria, it is shedding of red colored tears due to abnormal porphyrin metabolism and accumulation in the lacrimal gland. Diagnosis. Diagnosis is severity of poison depends upon the percentage of cholinesterase. Latent poison is seen if the cholinesterase levels is 10 to 50%. Mild poisons In mild poisoning, the cholinesterase level is 50 to 80%. In moderate poisoning, the cholinesterase levels is 80 to 90%. In severe poisoning, the cholinesterase levels are more than 90%. So, in organophosphorus poisoning, for diagnosis, knowing the cholinesterase levels are very important. True cholinesterase. True cholinesterase is RBC's acetylcholinesterase. So this true cholinesterase or RBC acetylcholinesterase is present in RBC, gray matter of brain and skeletal muscle. It is the most specific indicator of organophosphorus poisoning. Activity. If the activity of this organophosphorus poisoning is less than 50%, then it indicates poisoning.
thank you and thank you for watching.